Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Well, all right, here we are.
Hey,
it says we're live, April.
We're live. That's right.
Good afternoon or good evening to our audience. Because of the time change, it's dark outside. It's dark outside. So, but anyway, that really shouldn't matter because we got some very good information for our viewers. Hopefully you can take this information and kind of act upon it, because we think by having this topic this evening and with our guests that we could better inform you of where and how to get the medical services that you need in this area that's being offered. So April, we're going to introduce our audience to, I don't know if we've never had him on our program, but audience to our illustrious Conway Medical Center. That's our CEO and administrator of Conway Medical Center. So what do you want? Let you take it over.
Bring him on, yeah.
Bring him on. Let's just do it, because he said he has to go to dinner. So
I don't blame him. It's getting late.
It's getting late. So
good evening.
Good evening.
So good evening, Bret Barr, who is the Chief Executive Officer of the Conway Medical Center. And we are glad to have you on because if I'm correct, I think our viewers are going to be sending in some comments, wanting to know what is being offered what are they missing in terms of our medical services around Horry County, and how better they can be served by the new technologies that are coming into place. And I'm sure that Conway Medical Center is taking advantage of that, especially with your collaboration of Duke University, which is countrywide known, nationally known. So that collaboration with Duke has really put you all in the spotlight, which puts a lot of pressure on you, for example, to step up to the plate. So without further ado, Bret, you can go ahead and introduce yourself, and to a lot of people probably don't know you.
Yes, absolutely. It's a pleasure to be here. I met Edward a couple of years ago, and coincidentally, that's about the same time that our affiliation with Duke came into existence. Me personally, I'm the CEO for Conway Medical Center. Wouldn't want to be anywhere else. It's a wonderful place to work, and my wife and I moved here 24 years ago to work for Conway Medical Center. And I knew at the time that I interviewed way back then that this was a special place, very different. And I can truly say 24 years later, that holds true. So I'm very proud to be associated with Conway Medical Center. It's exciting times. Horry County is one of the fastest growing communities in the entire country. And we sit almost exactly in the middle of that growth. So we've taken on a lot of new initiatives in order to be able to provide the best service to this community that we possibly can. And so a good place to start, you mentioned it, Edward, was our affiliation that we established with Duke. They are top 50 in the country in both cardiology and oncology. And so we felt like that was a perfect scenario for us. We're the only Duke Health affiliate in the entire state when it comes to cardiovascular services. So we're very proud of that. And we get to tap into their resources, their expertise. And we started providing what to me is probably one of the most exciting things we've done here at the hospital in the last couple of years, and that is interventional cardiology services. They helped us start that program from the ground up, and today, since we began that almost 15 months ago, we have serviced well over 200 patients who have received interventional cardiology. And by that, what I'm talking about is those patients who are either having an active heart attack or need stent placements. And there is no question, because they're able to receive those services here, that lives have been saved, lives have been improved, because we all know during an active situation with a heart attack, that time is of the essence. So in order not to have to drive all the way to the beach, every minute means that additional heart muscle is saved. So we are well ahead of where we thought we would be at this point in time in the program, which shows how badly it was needed. And thankfully, we've probably got well over 200 people whose lives were either saved or improved because of that particular service. So that's something we're extremely proud of. Most of those patients all come from the Conway area or west, and we consider that an honor to be able to service them in that capacity. And then shortly thereafter, we affiliated with their cancer program. We had such a great success with the cardiology program that another thing we were seeing in this community, because it was growing so fast, that several people were having to leave this area to receive top-notch cancer care. And so they would have to often travel several hours, which is very difficult for a lot of people and families in that situation. So by establishing the service right here locally, with the expertise of Duke backing us up, we have serviced well over 700 people. And those are individuals who would have had to have driven either to Charleston, or oftentimes they went to Duke from here. So now they don't have to travel all the way to Durham. They can stay right here locally. We've got excellent oncologists right here. We have all the services that are required to help those citizens that have cancer, unfortunately. And we saw that, within Horry County, cancer happened to be one of the fastest growing areas that needed attention. There's a lot of lung cancer, there's a lot of prostate cancer, a lot of breast cancer, and the numbers were just growing and growing, even without the actual population growth. So when you combine that with the people that are moving into this area, with those that already lived here, it made so much sense to partner with them. And we're extremely happy with how everything has gone with both of those service lines.
Yeah, that's an enormous outline of those services. Bret, I want to get into some the meat and bones of those things, like the uninsured. With all the new technology and all this stuff that's being offered, that takes, that requires, well, it's not cheap, let's put it that way, for you all to implement these things.
It's not. And Edward, that's one of the things that has kept me here for 24 years is our mission here at Conway Medical Center is to take care of everyone. And we really know that there's a certain population that exists that just does not have the ability to pay. And that makes no difference to us. We're here to make people's lives better. And that's what we focus on. And we take a very active role in reaching out actually to the uninsured and the low income populations, those areas that are more rural, we take great pride in being able to take our world-class services out to them. We've got a foundation that supports a mobile health reach van where we can go out into the various communities, visit the churches, whatever community organizations that we can align with in order to bring mammography services to those people who can't afford it. We also, because of the situation with the global pandemic in the last 2 years, we've made a large effort to reach those people who want vaccines and either couldn't, afford it or get to a place where they're able to receive a vaccine. So we've spent a lot of energy and time in being able to travel out and get to those places where people can get their vaccinations or other diagnostic testing that will help them out. So we focus a great deal on that. I'm very proud to say that we recently just received a little over $1 million grant from the FCC to expand our telehealth services. And that is specifically focused on reaching out to those low-income individuals throughout Horry County and the surrounding area to specifically help them, because they oftentimes don't have a way to make it to their physician's visit. And so we feel like if we're able to get to them and do a telehealth visit, and they can do that right in their home, that is going to make a huge impact. So we're extremely excited to deploy the resources that we were just granted to reach the low-income population, as well as focusing on the veterans who oftentimes need assistance in that regard. So we're super excited about expanding that program and getting out into the communities further.
There's a question in the thread. May I call you Bret?
Yes.
Okay.
Certainly.
There's a question, and it's coming from Priscilla Fuller. She wants to know, is there a reason medical emergency room services are not placed in Conway, since at different times of the year, the traffic is a barrier to get into the hospital? Are there any plans in the future to open some type of a satellite facility in the Conway area? Yes,
absolutely. That's been on our radar, and we know with the fast growth continuing westward, that is absolutely going to be an essential service. So that is definitely something we intend to pursue. That's she's exactly right. So we've had multiple discussions around that, and we will be pursuing that.
Okay. So you're obviously, the collaboration with Duke is a win-win for not only our area, but I think it's a testament to obviously the integrity and the people's belief in Conway Medical, that you could even attract such a collaboration. Since that collaboration has happened, how has it impacted the workforce? And I'm sure that you're probably feeling the type of shortages that everyone else is feeling all around the country when it comes down to medical personnel. But, has this collaboration helped to kind of underpin some of what you needed? Are you hiring from within? Are you seeing people move into the area because you now have this collaboration? Tell us a little bit about that.
Yes, it definitely has helped secure the professional providers that are needed to head up a program such as cancer and cardiology. The nice thing about it is because Duke is top 50 in the entire country in both of those areas. In fact, they're well above the top 50. We get to draw on their several decades of experience around their quality programs and that is extremely attractive to the individuals that we recruit to this area to participate in those programs, because having that support to back them up is important to them, that they are able to provide the highest quality care possible. And when they have access to professionals directly by simply making a phone call or having them here on site, it really goes a long way toward assisting us in being able to recruit the highest caliber employees we possibly can.
Mm. Let's talk about COVID for just a second. I know that, everybody has a careful watch over COVID and Delta variant cases, and, trying to figure out how to navigate, moving back into society in a healthy way. What kind of trends are you seeing at Conway Medical at this time? And what do you believe is going to happen as we move into 2022?
Yes, it's been a journey, that's for sure. We were the first hospital in the state of South Carolina to administer the very first vaccine, which we were extremely proud of. We have, over the last 2 years, spent a great deal of time and energy trying to distribute as much of the vaccine as possible throughout the county. A lot of people don't have easy access to that, so we've made that a huge initiative to get out into the communities to provide the ability to receive the vaccines. At this point, we have administered over 64,000 vaccines in Horry County alone. And we continue to push for that. The percentage of individuals who are vaccinated is not high enough.
Right.
And so we continue to try and educate and allow people to make the decisions for themselves. But it's clearly the case where vaccination is an answer to the problem. We've worked closely with Horry County Schools and also Coastal Carolina University, as well as several other businesses, Horry Telephone and so forth, to get as many people vaccinated as possible. And I think that's the key. It's been a very long 2 years.
Mm-hmm.
The entire operations of the hospital have been turned upside down, and every day that's where we spend our time. And so, the best thing that anyone can do is to get vaccinated. But at the worst, we had as many as 65 COVID positive inpatients, most of those in very serious condition. Today, we have 6 COVID inpatients, the majority of which are unvaccinated. And that's the key. I think the key is if we can continue to increase the percentage of those individuals to be vaccinated, we'll continue to see improvement. I know other hospitals in the area have seen a similar trend in the downward pressure on inpatient COVID hospitalizations, although it is still continuing and people are still passing away from this disease that is mostly preventable. I just can't stress enough how much of a pro-vaccine person I am. The stats are just overwhelming in terms of those individuals who end up being hospitalized and either having the ultimate poor outcome or being what we call long-termers, where they leave the hospital and they're left with debilitating after effects. So we continue to fight the battle every day. So.
So what about the you mentioned your telehealth abilities? I'm sure that has grown since because of the COVID quite a bit. Do you find that as a plus? Will you continue even after the COVID is Does lessen the impact, on the society?
Yeah, great question. We felt like it worked out extremely well in that environment. And that's why we feel like even though COVID has subsided somewhat, we feel like that type of an approach to reaching those individuals who, even prior to COVID, had difficulty seeking out healthcare, we think that's a great solution. So that's why we're very excited about the recent grant that we received to expand those type of services to reach the rural communities in Horry County, where, like I said, oftentimes people just don't have the ability, they don't have the family support to be able to come in and see their physician on a regular basis. So oftentimes they don't take their medicines, and they miss physician appointments and so forth. But with the ability to have telehealth right there in front of them, it makes it much easier to have a conversation with their provider about how they're feeling and what needs to be done to keep them as healthy as possible. So we're very excited about that.
Mm-hmm. We have another question in the thread, and it actually comes from Sister Joella McQueen, who, as you know, is the wife of Brother Edward here. And yes, she's the real boss of this show.
Undercover boss either.
Exactly. She wants to know, how do you service the nursing home populations?
The nursing homes were a little bit different in that their COVID supply was different than what the hospital's supply was. They were provided the one-shot dosing just because it made it much easier to get as many of those folks vaccinated as possible, as quickly as possible. So we always assist them in whatever way we can. But when it came to COVID, they had a little different system than what the hospital's route was to provide vaccine to the community. It wasn't any worse or any better. It was just different.
I don't know if this makes a difference to our viewers or not, but your CMC is nonprofit, right?
Yes, sir. We're a private nonprofit, and we have been since 1928.
Wow. So
we've been around for 93 years, and
wow.
Yeah, it's amazing. It started in a little house in downtown Conway, and now it's grown to what it is today, and we're looking to expand even more. So we're trying to keep up with what's happening in Horry County and intend to do so.
I have a question that's a little bit off tangent. You said it's been around for 93 years. How far back do you archive records of your employees?
Well, we have some records that are rather, I guess, well preserved. They've been around a long time. It's very interesting to go back and see some of the things that were in existence. For example, I have a handwritten bill from 1934 that was provided to a mother who had a baby here in the hospital. And it's on one piece of paper. It's yellow. It's handwritten. And they were charged $5 a day for the 5 days that they stayed in the hospital. And I think they added an extra $1 for something. So their entire bill was $26 for 5 days in the hospital. And it was written on a literal piece of paper.
Yeah.
So I find that amazing, given
Absolutely.
what is today a very non-patient friendly system in terms of billing and those types of things. But there are some historical records that are very interesting that we still have displayed here in the hospital.
Right. And Brother Edward, the reason why I asked is because, you remember we did the show about Black nurses in Horry County, and we
Yeah,
featured
right.
some nurses who were employed by Conway Hospital, and there's
Yeah.
just a lot of rich history there. And
Right,
so
yeah.
it would be interesting to see those things in like a hospital museum of some sort, if it were possible. The
Yeah.
artifacts from that far, because the hospital at this point is almost 100 years old.
Right.
Yeah.
It's amazing. Mhm.
Yes, I still have the pleasure of working alongside Phyllis Cannon, who is the longest serving employee in the history of Conway Medical Center, and she is in her 52nd year. And she is still a joy to be around, and actually it does tremendous work. So yeah, we have a lot of history here.
Mm-hmm.
Yeah, it'd be nice to have access to something like that, some of that history. Like April said, we did one of our issues in the magazine was on Black nurses who started off really, and back in, I guess, in 40s, right, April?
I think it was the 40s. Mm-hmm.
Yeah, and to go back and kind of think of all those things that they were capable of doing, those skills that they had, like everybody else. It does wonders to a child's mind today to know that they had nurses like that who were very skillful, saved a lot of lives, I'm sure. Living right in the neighborhood next door.
We all know nurses run the show.
Yeah.
Yes, they do.
Mm-hmm.
Absolutely. So you're not at one point, I guess, in a matter of months ago, that the nation stated that there was a shortage of certified nurses. Does that still stand?
Yes, that's an ongoing massive problem that COVID has, I guess, shown the light on. We've known for a while that we were heading toward a nursing shortage. The average age of the nursing population kept climbing and climbing, and we were not producing enough new nurses. And because of COVID, that has just really sped up the severity of that situation. So we are trying to be as proactive as possible in that regard by teaming up with Horry Georgetown Technical College. We're doubling the capacity of the program in partnership with Horry Georgetown to be able to train more nurses to come out of that program. Fortunately, Grand Strand Medical Center at the beach has been approved for a rather large nursing education program, so they will be able to train several hundred nurses once the program is fully up and running.
Right.
But even with all of those attempts, I feel as if though that's still not going to be enough. So we'll continue to evaluate that and see what we can do, because they're just not enough. It's just a supply and demand situation that really has created a problem for all hospitals, not just Conway Medical Center.
So do you think one of the basic issues is just getting the word out there to the common person, and maybe compelling them to go to a school like Horry Georgetown Tech and get that kind of skill?
Yeah, there's absolutely almost a limitless career opportunity in the nursing field at this point in time, if that interests someone. So I believe the governor recently announced that he was allocating some of the relief money to provide a free education for those that are considering entering into the healthcare field through the technical colleges. So that's a huge incentive for someone who may have been wondering how they are possibly going to pay for school.
Yeah.
So with that worry off the table, hopefully we'll be able to see many more people entering into that program, and you know, it's not going to cure the situation overnight, but it sure is a step in the right direction.
So, off the top of your head, what is typically the average age now of nurses that they're currently serving?
Yeah, I know it's in the upper 40s. There's sort of two different groups. You know, average is one thing, but what we have is a group of younger nurses in the 20s and 30s, but then we also have those that have been in that career for some time. And quite honestly, what several of them have done, it's just been an overwhelming scenario over the last couple of years. And so those that may have worked another 2 or 3 years before considering retirement, I believe have just decided to retire. The toll that COVID has taken on the direct frontline nursing staff is it's been heavy. So I think it has convinced some people to enter retirement earlier than what they would have otherwise.
Really?
So that's why we need to speed up even quicker in order to make up for that scenario.
For those who may be watching and considering the nursing career and the point that you just made about the kind of the wear and tear on the nurse, what is Conway Medical Center doing to provide support services for your medical personnel? I'm sure that COVID has, called for a need for mental health counselors, any other type of resources that can help people cope with what they're dealing with every day. So, and probably a part of the recruitment process that could help is for potential candidates to know that there are some support services out there. So, what are you all doing to assist with that?
Yeah, first and foremost, it's very important that we keep our employees safe. So from day one, we have made it our mission to make sure that we have all of the personal protective equipment necessary in order to keep them safe and not have them jeopardized. That has been a monumental task. But then, we have experienced over 200 deaths here at Conway Medical Center because of COVID. And that really is a very unusual situation. It's a very taxing situation. Oftentimes we have COVID patients that are in the hospital for long periods of time. So every day the nurses are seeing these struggles. And it's not just nurses, it's all of the staff. It's the respiratory therapists. It's the people who sterilize the rooms. It's everyone involved. It affects everyone. So we have employee assistance program where they can talk to licensed professionals and just be able to, seek out counseling if that's what they wish to do, and talk through some of the struggles that they've gone through. But we're here to support them in every way. We know it, we see it every day, what they experience, and we try to, what's really been heartfelt is the fact that so many people have reached out. We've had so many organizations that have stepped up and provided food for the staff. They'll come by and they just at shift change, we'll, have signs saying thank you for what you've done. And you just can't put, a measure on how much that means to them, that people appreciate what they're doing each and every day. So, but we'll continue to provide whatever we can to help them out.
So, what does it take for an entity, a local entity, to ask for your services to come out maybe in a mobile form to have a mobile services at any contentious time?
Yes, so we coordinate that through our marketing and foundation departments. Those numbers are on our website, and anyone who wishes to see about scheduling a time where we can come out to help them can certainly call, and we'll be there. So it's not a difficult process at all. All they have to do is call and ask.
All we gotta do is call it in.
Call it in.
Just that's it. Maybe just a general question. I probably never had the opportunity to ask any CEO of any hospital this question, but when will or do you have any intention of Conway Medical Center becoming called hospital instead of medical center? So what's the basic difference? I'm naive about,
Yeah, it's really not a large difference.
Yeah.
Our official name is Conway Hospital Incorporated,
Oh,
but
okay.
that sounds a little cold. So we like to be known as Conway Medical Center.
Right.
It's a little more comprehensive and excuse me, and a little less technical. So other than that, Edward, that's really all it is.
That was just for me wanting to know personally because
Just curiosity.
yeah.
Yeah.
Just curiosity.
Yeah. Okay. Yeah, you about to say something, April?
I was going to say we've learned a lot of great information tonight about
Absolutely.
Conway Medical Center and
Absolutely.
all of the strides you're making, and this new partnership with Duke Health is certainly going to catapult Conway Medical Center into an orbit that I'm sure Horry County has never seen before. And definitely you can't skimp on great health care. And so
Right.
whatever you can do to continue to make things better as far as wellness and health are concerned for patients, and offerings that we have in this community, I think that that definitely remains top of mind with you. And so we definitely appreciate it, and definitely appreciate having you here tonight to talk about all of this good stuff.
Well, thank you. I appreciate the opportunity to share what's happening here. There's a lot of exciting things happening, and so it was a pleasure. I appreciate it.
Yeah, I wanted to have one last question here. When do you do? Is it a difficult decision, or you have something in place when you have to have a surgery, emergency surgery with somebody, but COVID might take precedence? A COVID patient might take precedent. What do you do? What methods do you have in place for that?
Well, any emergency, and maybe I'm not understanding the question exactly, any emergent patient will be treated accordingly. Whether the patient is COVID positive or not, they'll receive, whatever emergent services are necessary, up to and including surgery. Was that your question, Edward?
Yeah.
Okay.
Yeah.
If a patient does happen to be COVID positive, of course, we take personal protective measures on all patients.
Right.
So whether they're COVID positive or not, and they're having surgery, all of our personnel are protected to the fullest. So.
Yeah. I recall that when that question was brought up in the magazine one time, and we asked, where do patients go when you have to cancel surgeries? Because I guess during that time, COVID was so heavy that time, and it probably took precedence over everything else. Okay, and also
we did have a period, extended period where we canceled all elective surgeries, but if there was an emergent scenario, those cases continued to be taken care of. So.
Yeah. Okay. All right. I guess I can't think of any more questions now. But April, you want to read off the thread for what our city councilman has to say?
Oh, he asked a question that's already been answered. It was he wanted to know, will you have a site in the city of Conway?
Absolutely.
Would be a site or more than one?
Yeah. Don't tell anyone.
Okay. All right. So look, I think man, I think this has been very informative. I'm glad we got to get you on, and you can, especially for areas that that really need mobile services. I'm focusing on that in mobile service because, believe it or not, transportation is an issue in certain areas, low income areas. Okay.
Yep.
And
you're absolutely right. We do a community assessment on the areas that are most vulnerable, and that is one of the top reasons why people fail to get their health care is because they have no way to get to the appropriate spot. So you're right on. So we're focused on that, and that is definitely part of our plan to continue to service that, because that's what we do, and that's part of our nonprofit mission. So.
Yeah. Right. Okay. I guess hopefully for our viewers that we've had some very informative issues and that I think needed to be discussed. We had some of our own, then we had some in the thread for people to comment on. And
well, thank you for having me. It's a pleasure
dialogue here.
Being able to share what's happening here.
You're so welcome. And it looked like you're going to make that dinner.
All right. Thank you.
Yeah, to our viewers, Bret wanted us to know that he was.
Dinner waiting.
Yeah, that's right.
I don't blame him.
Yeah,
that's peanut butter and jelly, Edward.
Hey, that's better than a lot.
Well, yeah, just a couple of comments rolling out. Priscilla Fuller says, thank you for all the valuable information. And Councilman Larry White says, thank you for the medical van visiting our community. So keep doing the good work.
All right. Thank you very much.
All right, man. We'll be talking with you.
Okay.
Thanks.
Good night.
Yeah, and to all of our viewers and also to our guests tonight, we hope that you all have a safe and blessed Thanksgiving holiday. Enjoy your families. And remember, we are still in COVID season. So just, use precautions and make sure that you are protecting your loved ones. And, Brother Edward, everybody in my family, or I will say 95% of my family is fully vaccinated. I just got my booster. And I don't want to take any chances. There you go. I don't want to take any chances with it. So,
looks like everybody's all set. So
yeah, we're all set.
Happy Thanksgiving to everybody. Okay. So
all right.
Thank you and God bless. We'll see you all next week.
Take care.
We're gonna run some. April, you want to run some commercials?
Yeah, I can do that. Thank you, Bret. Have a good one.
All right. Good night.
Thanks a lot. So much, Bret.
Yep.
Okay.
All
Hey,
right.
hey, we're back. We're back.
We're back for a few more minutes. All right.
You always have some people calling after the fact, right? And
Yeah.
texting after the fact, But April, this past weekend, there was a book signing by the gentleman that we had on a couple of weeks ago.
Dr. Tony Smith.
Brother Antonio, yes. I'd say Minister Antonio. Great book. This one has your name on it, April.
Thank you. I'm glad you picked one up for me. Yay.
Yes. It says APRL IL.
Oh, goodness.
Sister has a way of putting things on like that.
How was the book signing?
Oh, great. Really great.
Yeah.
Really, really great. And send you some photos of the crowd that was there. Yeah. I just thought it went well. And the comments from the people, it was just it was heartening, and very impressive. What's more impressive is the volume of the book. I mean, it's like over 320 pages.
Yeah.
So that says something about Reverend Antonio Smith. And for those of you who don't know, he's the son of our historical black cab driver, Mr. Alfred Smith. Okay. Who's of course is gone now. He's deceased, but just wanted to throw that out. Okay. And we because we had a few more minutes, we wanted to talk about not just him, but the thing, one of the things that he's doing. I wanted to, and the other thing is that the issue. My understanding is that about the there's going to be a mural. They're talking about a mural on the wall where Mr. Alfred Smith, who was also a volunteer fireman in Conway, and that building is now occupied by Father's Place, the fire department. It was called the Black American Fire Department, which served us very, very well. So and on that. Go ahead.
I was going to ask you, the mural is already done. Am I correct?
No, it is. The concept is done.
It's okay. Because I think Larry sent us a picture, and I was on the impression. Okay, so it's just a concept.
It's a concept, to my knowing. If it's up there since the last time I was there, then I beg to differ.
Larry, if you're still watching, let us know. And if so, we can definitely show the. Yeah, it looks like it's a concept, and the concept would actually be a mural of the
Whittemore.
Oh, Whittemore High School.
Whittemore High School. And you can't show it, right? You can't pull it up.
I can actually pull it up if it's okay to show it. Yeah, I can do that.
I don't see why not.
Okay.
I mean, that's just one of the concepts. Okay.
That's one of the concepts.
Yeah, just one of the concepts.
Okay.
And I'm sure it's going to be others that are coming up, and the choice hadn't been decided upon yet.
Oh, okay. Well, then I won't show it. This is one of the concepts. I won't show it.
Yeah. But it's very thoughtful, the way that particular concept. So, but anyway, that's what I wanted to get over to our people today. And again, we thank everybody for listening and viewing our program today. And hopefully, I can't tell you who's going to be on next week because we don't know right now. To be very honest. April will come up with somebody.
I'm not making any promises. April's going to be on Thanksgiving vacation.
Oh yeah, that's right.
Yes,
right.
It's Thanksgiving this week, but
they'll probably just be coming back from eating. So, but we'll inform everybody. We'll keep everybody informed.
Yes, okay. Absolutely.
Okay, and don't forget tomorrow with Janet, my sister Janet. She has Does she have guests tomorrow?
We are not doing a show tomorrow.
Okay.
If I'm not mistaken. Keep talking. I can get her real quick and find out.
Yeah. Yeah.
Because I think she's already taken off for Thanksgiving as well.
Yeah, she has wonderful information to convey to because everybody, and I'm just impressed with that. I really am. So, and she's been great at that. Very resourceful person. Educational resources for our youth.
Mm-hmm.
Okay, where they're going and stuff like that. So, anyway, April.
Well, we're working on that. And any new developments on the Whittemore Elementary School project?
I don't know any new developments, except that I know that they're continuing having dialogue as a group, and with the Conway City Council.
Mm-hmm.
There's always someone there,
right,
to make sure the voices are heard regarding the desire for not destroying it, okay, and keeping the legacy alive. So that's as much as I know about that.
Okay. Well, I'm sure they're going to continue the good work. And as I mentioned on a few shows back, the Whittemore, Janet says that Educate Our Youth will be back on November the 30th because she is out for Thanksgiving. So,
well, all right, Janet.
Yeah, we'll be back on November the 30th. And speaking of, the Whittemore Elementary project, of course, definitely a connector as far as that project is concerned is the Whittemore Alumni Association. And so hopefully in 2022, there'll be a good push for more participation in the Whittemore Alumni Association. And there's a group of people who are meeting, trying to figure out, what are some things that can be done to create more engagement in that particular association, because it's very important. And between the Whittemore Alumni Association and the Whittemore Elementary Historic Society, I'm sure that there will be some powerful voices lifted to assist with trying to make sure that the Whittemore Elementary project basically gets the exposure that it needs, and also that there will be some positive inroads, a positive solution for that particular project. So,
I think my understanding is that a lot of interest has been gotten from some very youthful people. I'll say, and that's encouraging. Yeah, I like to see that. So, always refreshingly new faces is always valuable to an organization like that, especially alumni organization. So
right.
Organization.
All right. Well, Brother Edward, it's that time. It's that time. So
that time.
I know. Enjoyed it once again. And again, we hope that everyone has a safe Thanksgiving, and we will see you whenever we're back after Thanksgiving.
Absolutely.
Yes.
Absolutely.
All
so everyone have a good Thanksgiving and a good week, rest of the week. God bless. And see you next week.
All right.